Hi there, and welcome to UEA Mental Health, and we have Jane with us. And I'm going to speak to Jane about how she got into nursing and some of her experiences with nursing. Hi Jane.
Hi Jason.
How you doing?
I'm fine. Nice to be here today talking about nursing.
Yeah. It's slightly artificial, isn't it? But I've known you for years and you supported me through my nurse training.
I did.
And I suppose what I'd like to do is ask you some questions that perhaps I've never actually asked specifically. And we were talking just before about your pathway into nursing and that first sort of I want to be a nurse moment. And I didn't know that, and I think it's really interesting, not necessarily surprising. But yeah, tell us about it. What was the moment when you first thought, I want to be a nurse?
Well, it was a childhood thing for me, and I know this because for many years I had in one of my books that I'd written in school in pencil, when I grow up, I want to be a nurse.
And to clarify, how old were you?
I think I must have been about 5 then.
Brilliant.
And what I had written in that book was, and I'd drawn a very interesting picture. My artistic skills were not great then and they haven't improved, but of helping someone to walk. So my image was obviously about helping someone to walk. If I was to tell you about when I decided I wanted to be a mental health nurse, that would be different because I'm someone who was educated as an adult nurse first, which I'd wanted to do from childhood. I even had the uniform that I used to dress up in when I was a child as a nurse. But it wasn't until I was doing my adult nurse training that I found out about mental health nursing, and I was on a mental health placement as part of my adult nurse training. And I thought, this is what I thought nursing was about. This working with people, helping them to meet their goals, being alongside them at times of distress. So I also remember the moment I decided I wanted to be a mental health nurse.
Was that something you said that you thought that was what nursing was all about, but when you were this young child you sort of drew a sort of picture of someone physically unwell. Was it something that along your adult nursing career you went, this stuff's really important?
It absolutely is. It is, Jason. It really is. I can remember being a registered adult nurse working with people who'd had I had 2 jobs as a registered staff nurse. The first one was on a renal and liver transplant ward, and so we were working with people who had a long-term, very debilitating illness, were in hospital for long periods of time, and I remember vividly the importance of the psychological care. I actually remember working with someone who was very worried about getting up and mobilising, and I can remember thinking to myself, if we don't do something to help this person, they're not going to mobilise. I actually thought, it sounds very strong, but I actually thought, if this lady doesn't get up, she's going to die.
And so the reason she wasn't was sort of almost psychological, was it?
It
more
was.
than physical? Oh,
it
okay.
was. It really was. And I remember that from my transplant experiences. I then worked on an infectious diseases ward, and people were being cared for in isolation. So everybody we were using universal precautions for, and again the psychological care. They were not seeing anybody other than somebody masked up. Really interesting when we think about what actually happened in the pandemic. It took me right back to those experiences of working on a medical ward.
And when you're noticing these things, you're a qualified adult nurse and you're noticing these things and picking up on them, is it that you felt, I don't know how to help this person, or is it just that you felt, I want to know more? Like intuitively, I know what I'm doing is helpful, but I kind of want to sort of like follow this thread of thought and I want to know more?
I'll be really honest with you, Jason.
Yeah.
It was neither of those things.
Okay.
It was more about, this is where I think my strengths lie.
Okay.
I was not the most dexterous, practical adult nurse. I learned, it's where my grounding took place. I value those skills. But I recognised in myself that actually sitting down and listening to people, helping to support them psychologically was an area in which I had strengths, and I was quite ambitious, and I couldn't actually see myself being sister on a surgical ward, but I could see myself on a career trajectory in an area I loved, felt was really important and passionate about, and that's what drew me to mental health nursing.
Okay, and that's a nice segue. So let's move into this part of your career, the mental health nurse. Tell us about the sort of early stages of being a mental health nurse, and then perhaps how you sort of your choices thereafter.
That's really interesting because I had two ambitions in my career, one to be a health visitor and one to work with adolescents, neither of which I've done, and which I'm very happy to say I'm delighted with how my career is turning out. So I think I loved my placements during my mental health education. I loved working on an acute working age adult ward, the acuity, the pace of the work, the crisis that people were in, getting alongside and getting to know the people that we worked with, working on wards which had geographical catchment areas, so we had long-term relationships with people even though we saw them in periods of acute crisis, working with people at their moments of most distress and seeing them get better through our therapeutic alliances, through the interventions that we engaged with them in that area. And I loved it. I loved that when I was a student mental health nurse. I loved actually working in the community and seeing the join up between the community services and the inpatient services. Really enjoyed that. I did have a placement on an adolescent unit, which I also loved. And I very quickly knew that I wanted to work in acute services, and I very quickly identified that I wanted to work in inpatient services. I will tell you, interestingly, I didn't drive until quite late in my development, and so I don't know if at that stage I was thinking I wanted inpatient because I wouldn't be able to do community work. That said, I know that it's the ward work that suits me.
There was some, actually that's interesting, so why? I can think of, like, as I've gone through my career, I probably did the majority of it in the community, but whenever I sort of think of, I'd like, before retirement, I'd like to do some sort of like a face-to-face nursing again, and I always think of the ward, and I know why, but why is it, other than not being able to drive, what was the thing that sort of grabbed you? What was it?
That's easy. The teamwork. The teamwork, the working together in challenging situations with people in distress as a team. I love teamwork. I like working as a team and in various roles in those teams. I was very lucky. I did realise my ambitions. I was promoted very quickly, and so I was a deputy ward manager, I was a ward manager. I have actually worked in the community in a day care setting too. Did lots of group work when I was doing that at the beginning of my mental health nursing career, which again really helped me. I did that for a year and then I moved into ward work. But the teamwork in those stressful but very rewarding situations.
And let's pick up on that, because I suppose nursing is an unusual career, and certainly mental health nursing. You've spoken about some of the really rewarding parts of mental health nursing, but it's not without its challenges and its stresses. And there's a balance there. I think of some of the stressful parts of my role that also gave me a really strong sense of purpose. But I suppose, what are some of the challenges that you found, and how did you manage those?
I think it's physically demanding, and it's interesting because I might say that my experience as an adult health nurse was very physically demanding, but I think it's physically and mentally demanding. I think it requires you to invest so much of yourself physically and mentally. You're making decisions. I think one of the things I also, and I'm thinking about it as I talk with you, Jason, I think one of the things that I found quite challenging was I'm quite socially confident. I don't know if that's coming across to everyone. And at certain stages in my career, I've thought I was right. And I recognised that when I was promoted and became a team leader, I needed to be very clear that I had that moment where I just sat down one day in a meeting and I thought, you better be very careful what you say, Jane. Everyone is listening to you. Everybody is thinking you're right. And I think it became challenging for me to recognise that I needed to manage myself differently. I needed to be sure that when I was saying things that they were tied into evidence. I also needed to be sure that I was democratic in the way that I was working, that I was taking account of everybody's views. And I also recognised that under pressure, sometimes I started to think that it was everybody else not doing what they should be, when actually it was some of my skill set and my leadership that perhaps was wanting. So I think the biggest challenge was developing my self-awareness sufficiently to do the best job I could.
That's really interesting. And I don't know if this is particular to nursing, but what you're talking about essentially there is a really powerful reflection on yourself. Do you think nursing has changed you as a person?
That's a brilliant question, Jason, I think, because I don't think about this so much now, but I've certainly thought many times over my career, am I a mental health nurse because of the person I am?
We'll keep going. Some things happened that wasn't related to anything you said there, Jane. We'll keep going. It's fine.
Am I a mental health nurse because of the person I am, or am I the person I am because I'm a mental health nurse? And I think it's both. Being a mental health nurse and having that education has certainly shaped the person I am, but I believe that I was attracted to mental health nursing because of my interests and attributes.
Okay, wonderful. And I suppose our audience, it might be a variety of people, but hopefully it's people that are thinking of a career in mental health nursing. And what might be one bit of advice you would give to someone considering a career in mental health nursing?
Be ready, be prepared to dig deep, learn about yourself, be in the best place that you can in order to help others to be in the best place that they can be. Using yourself as a tool is really important. Develop your resourcefulness. Think about how you have and develop strategies for keeping yourself psychologically well.
Fantastic. Well, yeah, I guess I just wanted to acknowledge the influence that you've had on me. You were there for the whole of my training some 14 years ago. And so, yeah, I don't think I'd be a nurse without you, Jane. I feel quite humbled that a lot of what you've said today is the first time I've heard you speak about nursing like that. So I'm really glad that we had this opportunity to speak. And I'd like to apologise to our viewers. I don't know why the background changed like that. And clearly I don't have information technology skills, but there we go. Yeah, thank you.
Thank you, Jason. Thank you for what you just said. It means a lot.